The Affordable Care Act is expanding the role of Medicaid in covering U.S. citizens' health care expenses. Initially, health insurers in the segment are seeing a nice bump in revenue, but there are issues in the system. How might they affect health insurers? A recent report published by Standard & Poor's suggests Medicaid insurers will see stable ratings despite big changes. Here to discuss the impact of Medicaid enrollment on the health insurance market is Joseph Marinucci, Senior Director at Standard & Poor's Insurance Ratings. Joe, welcome to the program.
Thank you.
Let's start with the ACA. What was the new law trying to accomplish with Medicaid, and how?
Well, a key provision of the law was to improve access to coverage by expanding program eligibility. This was done by raising the income cap and allowing for the inclusion of childless adults.
So what happened with enrollment in 2014? Did health insurers see increased premiums?
Yeah, program alignment has increased significantly through 2015. Underneath this, we've seen corresponding increases in enrollment and revenue for health insurers.
The S&P report says state policymakers are looking to shift Medicaid coverage to managed care organizations, away from fee-for-service plans. How could that affect health insurer revenue?
Well, health insurers continue to benefit from the migration of government-sponsored lines to the private sector, which is growing the end market and creating organic opportunity for health insurers.
What should insurers be concerned about as Medicaid enrollment expands?
Well, we believe it comes down to a few key variables, starting with rate adequacy, followed by the ability to effectively coordinate care for an increasingly diverse member base that is reflecting higher levels of acuity. Lastly, it's the capacity to manage growth from an operational and financial standpoint.
Thanks for that overview. We look forward to having you back as things progress.
Thank you.
If you'd like a copy of the full report on changes in the Medicaid insurer market, visit the S&P website.